Hi, good morning all. Myself Dr. Nirmal Jain. I am consultant interventional cardiologist practicing in Mulund and Thana, and I am the director of Manisha Universal Hospital Mulund and Sanjeevan Hospital Bhandup. Today we'll discuss about heart diseases in women. As we all know, heart disease is rampant in Indian population and it is taking an epidemic toll. And why we have chosen this topic, heart disease in women, because there are so many things which still not known in females heart diseases, and there are various atypical presentations are there. Even if you see in the Western population, awareness among the female heart diseases is not great. You can see even in the Western data, around less than 50% of the female patients, they don't have any awareness about heart diseases. And there are so many misconceptions are also there in the females, that the younger females, they are immune to heart disease. Heart disease is much less common as compared to male, but these are all misconceptions. If you see all the data, heart diseases can be seen even in younger generations of female. And we have seen many patients of around 35 years of age, 40 years of age with the heart disease. And recently I did an angioplasty of around 40 years of age of female, and she was having multiple vessel disease, and we have to do a bypass surgery also. Though the females are immune to heart disease in less than 45 years of age or premenopausal phase because of protective effect of estrogen hormone. Though estrogen is protective, but if you have many risk factors, then you can still develop a heart disease even in a younger generation. As the patient develops menopause, then the chances of having heart disease are much more, and that increases suddenly. And at the age of 55, male and females are equal risk of having heart disease. So these females also require awareness, they also require an early diagnosis, and they also require a correct treatment and aggressive treatment to prevent heart disease, to prevent complication of heart disease, and to prevent long-term heart death and heart mortality. So we'll discuss about what are the risk factors are there in the females, what are the different manifestations of females which varies from a male heart disease patient, and what are treatment options we have, and what preventive measures a female can take. So important thing is the risk factor. If you see the conventional risk factor for heart disease are like diabetes, blood pressure, smoking, genetic history, sedentary lifestyle. These holds true for female as well. But you have to be aware that if female patient is a diabetes is there, then chances of having heart disease is much more as compared to male patient. If a female is doing smoking, then chances of having a heart disease is much more as compared to a male counterpart. So we have to be very sure whether patient is a diabetic or smoker or hypertensive, and these risk factors, they require more aggressive approach as compared to a male counterpart. Regarding a traditional risk factor, as we discussed, but there are so many other risk factors are there which are unique to female population, and that is, one is if patient has developed hypertension during pregnancy, if patient has developed preeclampsia, that is a severe hypertension during pregnancy, if patient has developed diabetes during pregnancy, if patient is obese and having a polycystic ovarian disease, a patient is taking OCPs, that is oral contraceptives method for preventing pregnancy, and a patient is having multiple autoimmune diseases like rheumatoid arthritis, SLE. These are unique risk factors which are not seen in male population, but they can be seen in the female population. And if these risk factors are present, then patient is having more chances of developing a heart disease. So apart from traditional risk factors, we have very unique risk factors also, and we have to compile all these risk factors for risk stratification in female population. Now come to various clinical manifestations are there. Because of hormonal influence, because of the body structure, because of various atypical features, many female patients, they have various atypical presentations are there. Though the common presentation can be chest pain, chest heaviness, breathlessness, but we have seen many patients coming with severe fatigue, many patients coming with restlessness, nausea, vomiting, many patients coming with jaw pain, backache, and pricking sensation in the back they can present. So we have to be more sure, we have to be more aggressive in diagnosis heart disease in female population as compared to male counterparts. Now come to the diagnosis. All the methods what we use in a male population we can use in a female as well, but what we see because of the body structure, because of the sedentary lifestyle is much more prevalent in the female population. Stress test has a very high rate of negative predictive value, and along with patient with because of the estrogen hormone and various hormonal influence, vasodilatation can occur and patient can have false positive stress test also. So if you have any doubt in the stress test, then it is better to go ahead with the dobutamine stress echo or go ahead with the various nuclear related stress tests which has as good as positive and negative predictive value as compared to males. Now come with treatment part. If you see a treatment, all the treatment that goes for a male population that holds true for a female as well. And but what we have seen in our practice as well, and various data is also coming up, is the complication of the angioplasty, complication of this bypass surgery is slightly more in female population as compared to a male population, maybe because of the short size, maybe body structure, maybe physiological changes what we see in a female population. So but these female also require an aggressive approach. These females should be treated aggressively. And one more entity which is much more common in a female is a microvascular angina. This angina is seen is because of the blockages is in small vessels which we could not see in angiography. The angiographic coronaries are normal, but patient has a typical symptoms of heart disease which we call it as a microvascular angina or syndrome X. And these patients, the female will come with us, there will be ECG changes, patient will have a typical angina, we do an angiography is normal, but these require an aggressive treatment in form of the nitrates, beta blocker or various anti-anginal and antiplatelet treatment. So now even in the United States, they have data, the awareness among female heart disease is much less, though the population there is educated, and still the awareness is very less in female population. Now you can imagine what will be condition in our India, where education in the female is still less than 60-70%. And so what our social responsibility is there, what the responsibility of a political class, what are the responsibility of doctors is to aware females about heart diseases, how to prevent heart disease, how to diagnose a heart disease. We should never neglect symptoms of female. If having a chest pain or any atypical presentation is there, we should be aggressive like a male population to diagnose a heart disease and treat that. Now the preventive measures, what we can do to prevent a heart disease, we call it as a primary prevention. Before developing heart disease, what measures we can take? Most important is the sedentary lifestyle we should not adopt. And what we see, if you see a female population as compared to male in our population, it's around 25 to 30% of females, they are doing some or other form of exercise, otherwise more than 70% there is no exercise is there. So at least 30 minutes of walk or jog 5 days a week, that should be done, and patient should have a healthy lifestyle. Patient should have their weight control, because if you see a female population, because of sedentary lifestyle, because of the hormonal changes, because thyroid is much more common, these patients tend to have more obesity, and we know obesity is one of the risk factors for the heart disease. So the important thing is we require to control weight, we require to control sedentary lifestyle to more active lifestyle. Now the third point is to control the risk factors. If a patient is diagnosed as a diabetes, these patients has a much more chances of developing heart disease as compared to male population. And these patients, There is one more thing, important thing about the female population is a patient with a female, if develops a heart attack, there is a much more chances of developing a second heart attack in 1 year as compared to male population. And it is around 40% as compared to 25% in the male population. So once a heart disease is there, you require much more aggressive approach in female population as compared to male population. So healthy diet is also an important thing. What we see in our population, many females, though they're from a good background, still they are not having adequate amount of fruits, vegetables, and there is a more and more junk food is there as we are becoming more and more westernized. So diet is very important. And as we all know, in Indian population, dyslipidemia is much more prevalent, and what we see increase in triglyceride level, decrease in HDL level. As we all know, HDL is a protective lipid parameter, and Indian population and especially female populations, they have much more lower HDL. And estrogen is one of the hormone which increases the HDL, but once patient starts menopause, estrogen is gone, now the HDL goes down and patient's risk of the heart disease goes up. So important is a diet is one of the important criteria. One more thing is most of the female of more than 35 years of age, if they require some or other form of contraceptive, it is better to avoid oral contraceptive pills because these are the hormones and these can have a detrimental effect, and various data have come up that these can increase the incidence of heart disease. So early diagnosis, proper treatment, good lifestyle, and preventive measures as early as possible, and regular checkup is required, because what we see, if patient is in pregnancy develops blood pressure, there is around 40% chance of developing blood pressure in near future. If patient is developing increased sugar level in pregnancy or diabetes in pregnancy, then around 70% chance of developing diabetes in near future. So these patients will also require an aggressive follow-up, whether these patients is developing blood pressure or diabetes in near future. So overall, my suggestion to all of you is early diagnosis, aggressive treatment, good preventive lifestyle, and we should not neglect any symptoms in female, and female population should be made more aware about this heart disease problem. Females are much more concerned about cancers like the breast cancer, uterine cancer, but if you see all the data, heart disease is #1 killer even in the female population, and 1 in 3 female will develop heart disease in her life. But if you see breast cancer or any cancer, 1 in 30 female will develop cancer in her whole life. So heart disease is much more prevalent even in female as compared to cancer. So we require an aggressive approach in heart disease prevention, and we should do as early as possible. Thank you very much.